Ireland's doctor crisis. 1 in 4 work beyond EU safety limits. Are Ireland's doctors working themselves to burnout? A shocking revelation has emerged from the Medical Council's 2024 Annual Workforce Intelligence Report, highlighting the alarming number of doctors in Ireland who are working beyond the European limit. This raises serious concerns about patient safety and doctor well-being, as excessive work hours can have devastating consequences. According to the report, a staggering 23.1% of doctors in Ireland self-reported working more than 48 hours on average per week, contravening the European Working Time Directive, EWTD. This directive is in place to safeguard the health and safety of workers across the European Union by setting minimum standards for working hours and rest periods. But here's where it gets concerning. The disciplines most likely to exceed the 48-hour workweek were surgery, 50.9%, and obstetrics and gynecology, 34.9%. Moreover, among doctors who reported working more than 48 hours per week, a whopping 45.6% also reported working in direct patient care for more than 48 hours per week. This raises eyebrows, as excessive work hours are demonstrably associated with attrition, stress, burnout, and are predictive of adverse event involvement. For the first time, doctors were also asked about their views on patient care and safety. The results were eye-opening. Just over one quarter, 26.1%, reported experiencing difficulty providing a patient with sufficient care at least once a week or more frequently. On the other hand, slightly more than one-third, 33.6%, reported never experiencing difficulty. So what's hindering doctors from providing sufficient patient care? The most commonly cited barrier was pressure on workloads, with 73% of doctors reporting this. This was followed by time spent on bureaucracy/administration, 55.1%, and delays to providing care, treatment, and screening, 46.1%. The report also shed light on the demographics of Ireland's medical workforce. The mean age of doctors was 43.7, with 1 in 5 aged 55 or older. The highest number of clinically active doctors was concentrated in disciplines of general practice, 25.9%, and medicine, 23.4%, followed by surgery, 11.9%. Interestingly, the report highlighted a continued reliance on international doctors, who now account for 27.8% of the workforce. The most common country of qualification for international graduates was Pakistan, accounting for 39.7% of the international graduate cohort, followed by Sudan at 21.3%. Last year, 1,632 doctors left the Medical Council's medical register, with the majority being voluntary withdrawals. Of those who voluntarily withdrew from the register, 58.8% said they wanted to practice medicine in another country, while a further 14.5% said they wished to stop practicing medicine altogether. Is the Medical Council doing enough to address these concerns? We'd love to hear your thoughts in the comments below. Burnout alert. 25% of doctors work over 48 hours a week. Is healthcare at risk? A staggering revelation has emerged. Nearly 25% of physicians are clocking in over 48 hours each week, as highlighted in a recent report from the Medical Council. This finding raises significant concerns about the working conditions and well-being of healthcare professionals. According to the Medical Workforce Intelligence Report 2024, which can be accessed here, www.rte.ie, documents/news/Medical Workforce Intelligence Report 2024. Those in surgical fields as well as obstetrics and gynecology are particularly prone to exceeding this threshold of work hours. Alarmingly, about 45% of the doctors who reported working more than 48 hours a week indicated that they were directly involved in patient care, underscoring the potential impact on patient outcomes. The report also sheds light on the challenges faced by these medical professionals. Approximately 26.1% of doctors admitted to struggling to provide adequate care to patients at least once a week, while a little over one-third, or 33.6%, claimed they never encountered such difficulties. This disparity raises questions about the systemic pressures within the healthcare system. A significant 73.0% of respondents identified pressure on workloads as the primary obstacle to delivering sufficient patient care on a regular basis. This statistic highlights the urgent need for addressing workload management in the medical field. In terms of demographics, the report reveals that there were 20,962 doctors actively practicing in the state in 2024, with a notable 78.8% maintaining their registration with the Medical Council from the previous year. The average age of these doctors is 43.7 years, with over 20% being 55 years or older. Gender representation shows that 52.8% of doctors are male, while 47.2% are female. When examining the distribution of specialties, nearly half of the doctors are engaged in general practice, 25.9%, and internal medicine, 23.4%. Surgery ranks as the third most common specialty, accounting for 11.9% of the active physician workforce. Geographically, Dublin is home to almost 8,990 doctors, making up 42.9% of the total, while the rural county of Leitrim has a mere 34 doctors, representing just 0.2% of the total workforce. The report also highlights an interesting trend. 27.8% of doctors in the state hold an international basic medical qualification from countries outside of Ireland, the EU, and the UK. This figure has risen from 25.7% in 2023 and 23.3% in 2022. Notably, nearly 40% of these internationally qualified doctors received their education in Pakistan, while 21.3% obtained air qualifications from Sudan. Dr. Maria O'Kane, the CEO of the Medical Council, commented on the findings, noting a phenomenal increase in the number of doctors registering with the Medical Council in recent years. However, she pointed out a concerning discrepancy. Despite having over 30,000 doctors on the register by the end of 2024, only 20,692 reported being clinically active in Ireland during the same year. Dr. O'Kane also referenced a recent report on general practice in Ireland, which aligns closely with the Medical Council's findings. She emphasized the pressing need for strategic and sustainable investments in the training, recruitment, and retention of both general practitioners and other medical professionals. This situation raises critical questions. Are we doing enough to support our healthcare providers? What changes are necessary to ensure that doctors can provide the best care possible without compromising their own well-being? We invite you to share your thoughts and opinions in the comments below. Crisis in Irish healthcare. 1 in 4 doctors overworked and leaving for abroad. The Irish healthcare system is facing a critical crisis. A staggering number of doctors are overworked, leading to burnout and a mass exodus to other countries. This isn't just a statistic. It's a real-life problem impacting patient care and the future of medicine in Ireland. Let's dive into the details. According to a recent report from the Irish Medical Council, a significant 25% of Irish doctors are clocking in more than 48 hours a week. Think about that. A quarter of the medical professionals dedicated to our health are working incredibly long hours. And this is just the tip of the iceberg. But here's where it gets controversial. The report also revealed that over 1,000 doctors voluntarily removed themselves from the medical register last year. The primary reason? They sought opportunities abroad. This brain drain is a serious concern, leaving the Irish healthcare system understaffed and straining the remaining doctors. Of those working over 48 hours a week, nearly half reported spending those extra hours directly caring for patients. This means less time for rest, family, and personal well-being, which can significantly impact their physical and mental health. Furthermore, a quarter of these doctors admitted they found it difficult to provide adequate patient care at least once a week. This is a direct consequence of overwork and a shortage of resources. Imagine the pressure. The Medical Council's report also highlights the increasing reliance on internationally qualified doctors. While this influx of talent is welcome, the report notes that some of these doctors are facing challenges securing employment in Ireland. This is a complex issue, and it's crucial to understand the nuances. And this is the part most people miss. The report found that there were only 20,962 practicing doctors in the Republic in 2024, despite over 30,000 doctors being registered. This discrepancy suggests that many registered doctors are either not practicing or are working outside the country. The Medical Council has rightly called for urgent action, emphasizing the need for strategic investment in training, recruitment, and retention. Let's break down the numbers further. The study revealed that 27.8% of the 20,962 clinically active doctors in Ireland hold international qualifications. The majority of these doctors obtained their qualifications in Pakistan, 39.7%, and Sudan, 21.3%. This highlights the global nature of the medical profession and the importance of supporting doctors from all backgrounds. Of the accounting firm, 1,025 doctors who withdrew from the register last year, over 600 left to practice medicine in other countries. The remaining doctors either retired or chose to pursue other career paths. Of those who left, 352 were Irish-trained, 172 trained in the EU or the UK, and 501 were international graduates. The majority of those who withdrew were general practitioners, with 255 specialists and 29 trainee specialists also leaving. A concerning 149 doctors withdrew to stop practicing medicine altogether. Many doctors reported moving to the UK to pursue specialist training, citing a lack of career progression in Ireland. This is a significant issue, as it suggests that the Irish healthcare system isn't providing adequate opportunities for professional development. Several international doctors also reported difficulties finding employment in Ireland, even after registering with the Medical Council. One doctor shared their frustration, stating they were unable to secure a job or even an interview after waiting for 1.5 years. Here's a real-world example. One doctor, expressing their burnout, moved to Australia, citing low pay, understaffing in their specialty, and excessively long hours. The report also found that 12.9% of doctors are considering reducing their clinical hours. Jancy Cotter of the Medical Council emphasized that retaining doctors in Ireland remains a significant challenge. She also pointed out that excessive working hours, exceeding the limits set by the European Working Time Directive, contribute to stress, burnout, and absenteeism. This is a vicious cycle that needs to be addressed urgently. Now, let's talk about potential solutions. The Medical Council's call for investment in training, recruitment, and retention is a crucial first step, but what else can be done? Should the government offer more financial incentives? Should there be a greater focus on work-life balance? Should the system be reformed to make it easier for internationally trained doctors to find employment? What do you think? Do you believe the Irish healthcare system is facing a crisis? What solutions would you propose to address the issues of overwork, burnout, and the exodus of doctors? Share your thoughts and opinions in the comments below. Let's start a conversation and work towards a healthier future for both doctors and patients in Ireland.